giving some
Really
light
bring it
to,
in,
yeah.
We've got some public announcements coming that I'll let her share, but I really think they'll be a strong partner in looking at gaps in our community and maybe getting some funding.
You
for
could
the-
just start the video control.
I already had Stacy. Zoom link.
Okay, Stacy says she's not doing a meeting.
She's not.
She's not
Well,
feeling- she's not feeling well
She's
anyway.
now.
No, I mean, she didn't try and do a
Right.
Zoom.
Oh,
I
so,
understand that.
Yep, so you're good.
Is there anything that's going to be delayed by waiting until October?
Yes. We are the one, the city contract to approve. So,
And your thoughts? We've got the press saying we don't have good notice, so we can't let that in.
Well, I did send it to them. So, if we're lucky, there'll be a couple of those people.
Coming in, dinging in.
So you sent him a new,
I sent him the one that I'm in right there, where I emailed that to me, and I sent that to
sent you
you.
another link if you have to get in. Yeah, it's still saying meeting host will let them in soon.
It could be, go down to that 3 arrow thing. I may have done something that says that.
I clicked back on
Yeah, good.
enable.
Sorry, Ben, we thought we had it fixed, but it looks
So
like
I
we're
will
probably
click that
not
one
going
and
to
see
have
what
Zoom
happens.
option.
We did that already.
Been working
It
on
did
it, and
nothing.
we have IT involved, and they just don't.
okay,
they
now
can't
we
get it
disabled the
done, so.
waiting room. Yes.
But it didn't.
Yes, yes. Why don't
What
you
do you
call
do
me, you can call me
I'm sorry.
tomorrow, like at 9,
Yeah.
or
Yeah.
whatever time, what time do you get up?
Oh, you're good.
Okay,
Not too bad.
all right, take care.
Until now.
This is.
That was Ben Fisher. It's not working. So I told him we were just gonna go ahead and I'll talk to him.
What, did he get the email I just sent? Did he say? Yeah, he did.
And he clicked on it and it just tells him that the host will let you in soon.
Back to the waiting room.
We can begin the formal meeting so you can talk as a quorum.
Okay, so I'm gonna go ahead. We're starting a little late tonight because we've had a technical problem with Zoom, but this is our regular meeting scheduled for today, September 14th at 4:30 p.m. I'll call the meeting to order and we'll have roll call. Amy Crow-Sunleaf.
Here.
Hendrik Schultz.
Here.
Sandra Larson here. And 2 of our members were going to be present on Zoom and they were present, but we can't get them up. And so that's Adam and Jessica. I will fill them in as to what goes on at the meeting. At this time, we'll have public comments. Anyone may address the board on matters of which are on the agenda. Please raise your hand if you're on Zoom, which we don't have tonight, or stand up and state your name and home address here in the room. Individual remarks are limited to 3 minutes. Now, these are concerning matters that are on the agenda. Anyone have any comments?
Yeah, I do.
Okay.
And I'm, as a member of the Board of Supervisors, my name is Ann McDonough, 2469 Whitetail Drive. I think it's important that we, for purposes of transparency, consider tabling any matters which would be of public interest. So if we want to have general discussion, that might be fine, but any contract matters, anything like that, that would be my opinion to engage full transparency. We could schedule a meeting within 2 weeks, lots of other things we could do. But that would be my thoughts for the consideration of this board.
Okay, thank you. Anything else at this time, Ms. McDonough? Any other public comments? Seeing none, then we'll move on to chairperson announcements and updates. The first thing I wanted to do was just do a little thank you, shout out to the other board members who have been working hard this past month. Hendrik, want to thank you for your proactive action on the boil alert for the county. I appreciate your input there. And Adam Hoffman has been meeting with the environmental specialist Bailey, and they're both working hard on ways to improve our outreach in the environmental part of our health department. So thank you, Adam. And then I'd like to thank Amy and Jess because they're going to kind of go ahead and meet with the recruiter in this next week and winnow down the applicants that we've gotten so far in our executive director search. So I appreciate all that help and just wanted to do a shout out to everyone for your hard work. Then as far as the executive director search update, applications are coming in. I spoke with Maureen Berry yesterday. She's the recruiter and she has a list of 6 or more that meet the minimum requirements. There is at least one that has graduated from the Masters of Public Health in Iowa. And there's another that maybe is a department director or assistant director of a health department here in Iowa that has applied. So some really, I think maybe some really good candidates. We haven't seen them yet, but we're hopeful. This week, Amy and Jess will be meeting with Maureen to go over those candidates and pick the ones that we will be doing virtual interviews with. The virtual interviews will be either the first week in October or the second week in October. It depends upon scheduling issues and things, but we'll get those scheduled as soon as we can. I have no other comments, so we'll move on now to the Board of Supervisors, Board of Health Liaison.
You do not have anything to share.
Thank you. Next is the approval of the agenda, and I think we would like to just add one thing, and that would be to discuss whether we're going to table any of the actions on our agenda. So I'll move that we approve the agenda with that one addition.
I will second that.
All those in favor say aye.
Aye.
Those opposed? Okay, so our agenda is approved with the addition of discussing whether we should table anything that's on the agenda. So let's go ahead and discuss that right now. We have the one contract. It's a contract agreement between the City Health Department and Dubuque County Health Department. And it is to make sure that we have a point of information officer, basically. And so they would be in charge of doing most of the communication for our health department while we don't have a director in place. So I think probably this is one matter that we should table. Okay. Is there a motion?
I move we table the contract agreement between the City Health Department and the Dubuque County Health Department.
I second that.
All those in favor?
Aye.
Aye. Okay, so we will table that. That was number 8A. Okay, so then the next item on the agenda is the approval of the minutes from August 17th, 2022. Do we have a motion for that? Motion to approve?
Go ahead.
I was not there, so.
I'll move we approve the
I
minutes.
second that.
All those in, any discussion? All those in favor say aye.
Aye.
Aye. All right, the minutes are approved. The next, we don't have anybody on Zoom, right?
No.
Who's dead?
Nice to keep that. Oh, I'm on Zoom.
Is there a way that Stacy could call in to give her report or?
I have no idea if there is.
It would just be on your phone here.
Yeah, on speaker. I don't have her
I'm
number.
connected onto the computer. Projected off a computer.
Well,
If you have her number,
We're gonna be looking into that, and in the meantime, you can give the Dubuque County Health Department's monthly update, Laura.
I can do that. As Sandra mentioned, Bailey is working with Adam, and she's also coordinating with Corey from the Iowa DNR to put together a contractors meeting. It's scheduled right now for October 20th. Agenda contents not yet known, but it's I think a much needed meeting that we'll be hosting. I have taken and passed my water proficiency exam, so I am lab certified and now throughout the county. So it's 2 of us in the department that are certified. The health department's will be awarded $50,505 through the state of Iowa for grants to a county program. That money is used for things like testing the private well waters within Dubuque County, lab supplies, training staff, lab certified staff. And it'll also pay up to $500 towards plugging of wells. And to date, in our first quarter, we've used a little over 34% of that already. Breaking that down, we've done 100 private well tests. That accounts for $16,000 of that money. 2 wells that have been plugged at $500 each. 187.97 that's been spent on supplies. And then at the end of this month, Bailey and I will be attending the State Hygienic Lab's annual symposium, which was $100 a piece. So that'll be good training as well.
Okay, so it'll be just like 30 seconds.
We do test wells every Tuesday, and we have a very active waiting list. We are booked right now all through October. So
I have Stacy on the line. Stacy, you are on speakerphone.
Awesome. Can everybody hear me okay?
Yeah.
Perfect. Sorry about this.
no, I'm sorry.
If I would have been there in person, it probably would have been easier.
That's all right.
So I'll get started with just my regular report and then kind of go into just some of the activities as director and then just move into a COVID update if that works for everybody.
Yep.
So our tobacco grant, we're currently going through the schools pretty good, doing some presentations. This last month, we've been on three presentations within the schools for over 134 contacts. We've helped in connection with Dubuque Police Department and Dubuque County Sheriff to do a tobacco diversion class. And we've been doing presentations at Washington Middle School, 6th grade, West Dubuque health classes, 9th and 10th graders. And then we have Cascade and Roosevelt also scheduled for this trimester. Staff will be heading to Des Moines here this week for some required attendance through the program. For our Care for Ourselves Wise Women program, we've been off to a great start with Care for Yourself. We've had 59 women enrolled for limited screening services and had 10 screenings vouched for October, which is great. Our Wise Woman grant is wrapping up. It ends September 30th. And then our new grant year will start October 1st. And we just got the contract signed for that. And we have 5 women who have completed their 4th health coaching assessment. So really in a good spot there. Our local public health services, we had 59 patients served for home care aid, 63 homemaking visits, and 74 home care aid visits. We have 56 individuals on the waiting list, and we are currently down 1 full-time home care aide. So that is why our numbers are much lower this month than what you've seen. We've had about a 40% decrease in the amount of services just due to staffing. We do have that position posted, and we're actively recruiting. And I was excited to learn today we have 4 new applicants, so we will start those interviews immediately. Communicable disease, we've been keeping pretty busy. TB as well, we've again seen quite an increase in our latent TB follow-up cases. We're still following 3 direct observation therapy patients and then 22 late. So that's about a little over 45% increase from the previous month. So I think that, a good thing, it's showing a lot of testing going on, which started with, our testing events earlier in the spring, and it's continued. So good to see that as well. As just kind of an update of what's been going on within the agency, we've had 108 individuals present to DNA this month for triage services not related to our program. We've had the 46% increase in the latent TB follow-up since August. Our FTEs are still 4% below budget as we look to fill all of our open positions. And this month our Medicaid revenue, which was down about 20%. And a lot of times when we see it go down like that, we have a lot of patients that are coming in that are uninsured versus on Medicaid that we cannot bill for some of those direct services, such as immunizations and things like that. We're currently gearing up for our 2022 influenza vaccine season. We also had a very, very busy immunization month. We had 378 children vaccinated, 778 vaccines administered in the month of August. It's a 33% increase to what we would have seen in July, and a lot of that is related to back to school. We open up our clinics, especially the week before school and the week school starts, to try and get any kiddos in that are due and unable to start school on time. We want to make sure that we can get them in and back in school before they miss anything. So immunizations has been very busy. We will be doing all of our school audits throughout the month of October, so we're getting those scheduled right now. We're excited to announce that we've been awarded both our maternal health and our child and adolescent health grants through Iowa Health and Human Services, and this is for an 8-county service area, which includes Almaty, Chickasaw, Clayton, Delaware, Dubuque, Fayette, Howard, and Winneshiek counties. For maternal health, this was an increase in service area. We did not previously hold all 8 counties, but we do now. Both of those grants will start new October 1st, the same as our WIC grants as well in those same service areas. We currently have 2 open positions in our Dubuque office, and that is our full-time home care aide. And unfortunately, we lost a rep pay care coordinator this past month as well. So we are down 1 full-time care coordinator for that program. We've provided some outreach this month, including National Night Out, where we actually did COVID vaccines on site for that event. And we were also at the Back to School Bash as well at Audubon School. For emergency preparedness, we're continuing to work to participate with the incident management team for the after action report and planning contracting. The contract was finalized this past month, and so we're moving forward with that. And in terms of the interim executive director highlights, just some things that we have worked on this month. I've set up weekly meetings with Laura and health department staff to try and work through, get some consistent communication going between us. All IDPH or IHHS grants and have been contacted with the updated personnel changes, grant access, and contract amendments have all been taken care of. I've scheduled a meeting for tomorrow actually with our SA6 emergency preparedness coordinator to coordinate Dubuque County emergency preparedness grant activities and requirements. So I'll be meeting with her tomorrow to make sure that we've got everything we need moving forward for that. We've, as I mentioned earlier, executed the after action report contract. So that has been taken care of. Continuing to work with the incident management team on our weekly meetings, our public health preparedness meetings, and then also meeting with our vaccine providers, our K-12 schools, higher education, hospitals. We're continuing to do all the distribution of the COVID vaccines out of the VNA office throughout the county, coordinating with all of our wonderful providers. Then attending the elected official department head meetings, and then the Dubuque County Wellness Coalition. I will not be attending the Food Policy Council. I think there was a change there right before taking this over. And then I've completed the 2022 Local Public Health System Survey. It goes to Iowa Health and Human Services in order to meet our public health performance measure. That has been completed, uploaded into our grant. So we are good for another year there. And then I've actually been working with Iowa Health and Human Services. Both myself and Mary Rose have met with them, and VNA is going to become a monkeypox vaccine site. And I'll share a little more information on that here in a moment when I go through the COVID update. And finally, yesterday I attended the Public Health Services Collaborative meeting in Cedar Rapids. It's a required meeting through our local public health services grant. It was a great opportunity to meet with all the other public health administrators for the side of the state, and we had about 6 or 7 hours of being able to take a look at how programs are run in other counties and what similarities we have and learn best practice from each other. So we definitely got a lot out of that afternoon, and we're able to spend that time very wisely. For our COVID update, I know typically we just kind of show it up on the screen, but I will send this out to everybody as soon as I finish here as well. We are currently at medium level for Dubuque, as we've kind of been bouncing back and forth between excuse me, high and medium, and right now we are sitting at a medium. Our variants, we are still fully Omicron variant in Dubuque County as of today. Our positive COVID case trend lines have continued to slightly go down, and we're seeing a little bit of a decline as we've kind of stayed steady over the last few weeks. Our 7-day case count in Dubuque County is 91 as of today, which was down from 120 the previous week. Our hospitalizations are staying pretty steady and with 10. Our vaccination rates for Dubuque County, we are seeing just slight increases up to 70.1% of the total population with at least one dose and 65.5% fully vaccinated. We also were able to pull some booster information. 57.9% are fully vaccinated within our population on their first booster dose. And then there's the breakdown going forward down in the years, and I won't go through all that. I'll let you read it as I send it out. We were able to get some additional data that we haven't previously been able to get, and that is the second booster data for Dubuque County. According to this, the population the percent of the population 50 years of age with a booster shot that has had a second booster dose is 40%, and the population above 65 years of age with a second booster dose is 50.6%. So it's nice to see the additional data, and I look forward to see the increases as we go along. With our VNA COVID report, we administered 11 vaccines when the week ending on September 8th. We anticipate that that is going to go up tremendously when we do our weekly report this week, just based on the addition of the bivalent vaccine. We did increase our vaccine clinics, and we are now doing scheduled appointments just due to the limited availability of the vaccine. We're doing clinics on Mondays and Fridays both for the next couple of weeks to make sure that we can get that bivalent vaccine out to anyone who needs it. This is as well as we have the vaccine distributed to all of our medical providers as well. I know Mercy's been doing quite a few clinics, and then some of our other providers, Medical Associates, Grand River Center. I know Crescent was able to get some doses, as well as our pharmacy partners, and we'll be sending some out to Epic Wellness as well. So we are certainly getting the bivalent vaccine out as quick as we can and encouraging those to take it. Our calls did increase from the community this week to 39 calls, which is not surprising considering there was a change with the vaccines, but we typically see that. We'll continue to add on the extra clinics as long as the demand is there, and then try and get that vaccine out the door as quick as we can. We have a total of 48,674 calls since the very start of COVID through our office, and 11,904 vaccines. And then we will update this again for our Friday incident management team. I threw in just some monkeypox information in here as well. Right now in Iowa, there's 22,630 cases. That is up from 12,689 last month.
No,
No, wait.
20 cases is.
Oh, sorry, Dad.
Yeah. It's been making me a bit nervous.
22 in Iowa, and that is up from 15.
That makes more
I
sense.
apologize. So that would be a very big jump.
That would be.
Yeah.
And then just some information on the vaccine monkeypox site here at VNA. So we are working with Iowa Health and Human Services. Both myself and Mary Rose actually had the opportunity to meet with them and look at capacity and our community and whether or not this would be a good fit here. We felt that it was. The eligibility in order to receive this vaccine would be anyone who is living with HIV, anyone who reports being in a venue in which a suspected, probable, or confirmed case of monkeypox was identified, and people who report having close contact with someone suspected, probable, or confirmed with monkeypox, and any gay, bisexual, or other men who have sex with men or transgender people and their partners. And so there is some strict eligibility requirements for this expanded group. We are sending out a press release, went out this afternoon, and we have clinics scheduled that will begin Monday, September 19th here at the VNA. We will have clinics on Mondays and Thursdays for the next couple of weeks, and then we will probably incorporate it into our weekly COVID vaccine clinics. So I also included in the spreadsheet with the press release that's going to go out, and we will be looking to target the medical providers, the hospitals, the LGBTQ community and social groups, some of our community stakeholders, colleges. We want to get this information out to everyone so we have the ability to fill these clinics and then look at potentially scheduling more as needed. The vaccine that we'll be using is the Jynneos. I hope I said that right. And so we do have the vaccine on hand and we're ready to go. So hopefully Monday goes well, and we'll continue to meet with Iowa Health and Human Services every single week on Wednesday mornings just to kind of look at best practice, what challenges we have, what barriers we have. We have been able to attend 2 of those meetings so far, so it's been great having a resource group to go to whenever there's any issues or anything like that. So we're very excited for this. We've had a lot of calls and people that would like this vaccine, and we're glad to be able to offer it to the community. So, and all that information that I just went over will be in the COVID update as well, which I will send out here in a few minutes. So I think I covered everything unless anyone has any questions for me.
Thank you, Stacy. This is Sandra Larson. I have just a couple of thoughts as you were going through your report. Could you tell me again how many are on the waiting list for home care aid?
We currently have, apologies, I just moved it. I believe we have 56 on the waiting list
56?
right now.
And do you, last couple months ago, at least, I think we were trying to getting a report from you as far as how many of those people that need that care were out in the county, not in the city? Do you have?
Yes, and I don't have the exact number in front of me, but I do know when we looked it up, because it changes, because anywhere we can put in any of these people on the waiting list, that we can find another agency that can serve them while we're down on staff. But historically, it's been between like 10 and 20%, Sandra. That would be county-based versus city.
Okay.
But I will get you the exact number because we did calculate it.
Yeah, we just want to kind of keep an eye on that. And then, thank you, Stacy. Then the other question I had was, have you heard anything about the China HIP coming up, or is that still on hold, or what?
Sure. For the China HIP, typically in the past, as we geared up and start that, we had our core stakeholder group, which would have been Tom Berger, Mary Rose, myself, Patrice, or Sam, or someone at the health department that would start that communication. So we're looking to start that here before the end of this month and try and convene some stakeholders that we know will want to be part of that planning, and then moving forward into determining how we will start. In the past, we've done a community survey, which kind of gave us some general information to start with and got that out to community residents. I haven't had a chance to sit down with Mary Rose on whether or not that'll be the way we will go this year, but yes, we will be gearing up here in the next 2 weeks.
Okay. Does anyone else have some comments or questions?
So just a big question for my education, Stacy. I'm pretty sure you always have more people on the waiting list than you have staff to cover them all. What is in the past years, what has been your waiting list like? I mean, count COVID out. COVID is definitely a different kind of time frame. Is it usual that you have some people on the waiting list at any given time?
typically, but it's usually smaller amounts.
Okay.
This is the highest we've ever seen sitting on a waiting list for this long, and a lot of it has to do with staffing and
That's a common
and things
theme.
like that. But we've always had a little bit of a waiting list.
Okay. And the other
I would
question.
say probably less than 10 people.
Okay, oh, that helps, thanks. The other question I have, I looked over the monkeypox data this morning and it's spread out in 6 regions, I think, in the state of Iowa, and I think the eastern region where we fall in had 3 cases. Is there any case in Dubuque County that you're aware of? I know I'm aware of a lot of testing going on, but I'm not aware of any cases yet.
No, there is no cases
Okay.
currently, and
Okay.
the follow-up for those will still remain the same, that Iowa Health and Human
Yeah.
Services will contact us should we get a case in Dubuque County, and we will follow the follow-up for that,
Yeah.
but we have not been contacted of any positive cases.
Great. Yeah, and I mean, you're well prepared with what you have set up already. I think that's great.
Stacy,
Thank
I had one last question. You said the scheduled appointments for the bivalent vaccine. Do you need to schedule them Monday or Fridays, or are those still walk-in clinics?
For the bivalent, we've got them scheduled,
Okay.
just because we were trying to waste as little of the dosage as possible. We are still, we continue to have some open appointments each time we have a clinic, so we are not turning anyone away at this point.
Okay, but you would prefer somebody call in to schedule an appointment on Monday or Friday or any day, I guess.
They can call in any day and we'll get them in the first availability,
Okay.
but definitely we still won't turn anyone away.
Okay.
But yeah, calling in just makes us get a little bit closer to not wasting as many doses.
Yep, thank you.
Yes, Supervisor McDonough has a question, Stacy.
Stacy, when I was elected 4 years ago, this concerns China HIP. There was several folks complained to me that China HIP was not done with full public participation, and that comments were solicited through electronic online portal. And so when you read the China HIP, you'll read the addendum, which is the online comments, and you'll see that there's, I think, some things the board might want to look at, you know, like direction to substance misuse and you know, those kinds of things, and just people not being satisfied that they had opportunity to give input. I would just want to know, you know, what the plan is, you and Mary Rose visiting about that. Can we look at something obviously within safety protocols, but more robust to get public input into that process?
I absolutely agree with you. I think there's ample opportunity to improve on the data that we collect and the input from the community, and that's really the most valuable input we're going to get is going to come from the residents. So that will definitely be a priority to make that better.
And looking out into the county, not staying city-centric, but recognizing that more than 40% of the population live outside the city of Dubuque. So be intentional about how we include that.
Absolutely.
Thank you, Stacy. Any other questions or comments from anybody? Very good, Stacy, and just thank you so much for stepping up and helping us out while we're doing our executive director search, and you've been very, very helpful to work with. Thank you very much.
Not a problem. Sandra, Mary Rose is also having trouble getting on. She had messaged me. Do we want her to call in? I think she's next on the agenda, isn't she?
She was, but tell her that because we are having trouble with the Zoom thing, we've tabled that, so I'll give her a call tomorrow and talk to her.
Okay, that sounds good.
All right.
Thank you guys so much.
Thanks, Stacy. Feel
Stacy.
better.
Thank you.
All right, so very good. Just a couple of things. We kind of went fast over our Department of Health report, and I had a couple of questions or comments.
Oh, go ahead.
Wow, we've used up 34% of our budget.
Oh, yeah.
Wow, we're gonna come into a shortfall, aren't we? Probably.
Things will
Hopefully.
slow down,
Oh, yeah.
I think, but I will definitely spend
I
all of
think,
it.
I mean, I don't know how everybody else on the board feels, but if we do come to the end of our budget before the end of the year, I want to see if there's anything we can do to, you know, keep the water testing going. So
Oh, for
make
sure.
sure that we keep an eye on that.
Yeah.
But that's good. I'm really glad to see that we're getting a lot of water testing. Is there any way that the board can help so that we don't have that waiting list? Is there any way to start?
Well, I think the waiting list is good. I mean, people are interested and,
True.
it keeps us, I mean, we obviously can't do, 20 of them in a day.
Yeah.
Because we're literally driving all
All
over
over
the
the
county.
place, yeah.
So I think the waiting list is not a bad thing. But
But if someone if they have an urgent need to have their
well,
water.
we
tested.
obviously then put them, and we do have those happen.
All right,
Hey, I'm selling my house, I need,
yeah.
So, yeah, we do put them, it's not like we say, oh, no, you
Yeah.
can't until.
Well, just so we
But
kind
yeah,
of keep
no, we're
our
keeping-
thinking caps on to see how we could maybe reduce that if we can. Maybe we can't at this point, but
And this grant is through what's the end date of it?
The fiscal year, it's for.
Oh gosh,
Yeah.
yeah, that is a lot.
yeah. But I think that you don't do as much during the winter.
Well, we'll still do in-house testing.
Yeah.
So we'll still do the same number of tests,
Oh, okay.
really,
Yeah, we could really.
as long as there's a need for it and a desire to have their water tested.
Great.
And what's the prospect of Tina getting certified?
She's still in the training process, working in the lab, learning how to do the actual, the test that we do in the lab, which is for the bacteria, coliform and E. coli. And then she goes out water testing with Bailey.
So it's in process. It sounds
Yeah,
like.
it is.
And congratulations on
Thank
getting
you.
your
Yes,
certification. That's wonderful.
That's
Can I
great.
ask 2 questions?
Yes.
So when you're out doing the testing, is the office here closed?
No,
Okay.
no,
so it's
2 of them
open.
are gone, one is here.
And then the other thing is, are we collecting any data about the testing? Do we get results? Do we get
Oh,
to
yeah.
see?
We get all the results.
So
Like-
was anybody putting that into any kind of,
We have a spreadsheet and Teams that
so
we
that might
track
be something
everything.
we want to start to see. If we're doing the most robust testing we've done, maybe starting to share that would be certainly
That'd be
the
great,
the
yeah.
board would be interested in seeing that, and I imagine you would be too. We're doing the testing for purpose,
Right.
and then I know that we don't know whether or not people follow up with our recommendations, but maybe we could get that on a voluntary basis, people reporting if they intend to, or they have, or they did, or something.
And they do, almost always. I honestly can't say that I know of anybody who hasn't said, or who has said, yeah, no, I'm not gonna shock my well, or I'm not gonna, try to mitigate because they always come back. We'll do, Iowa grants will test 1 well, 1 home per well per year. And if we come and test your well and say, hey, you've got E. coli, or you've got coliform you shock and then retest within 7 to 10 days, and that's on their dime. And they always, almost always, and I can almost say with 99% certainty that they always shock and come back and retest, because that's their drinking water, that's.
We have heightened interest
Yeah.
now that the city's experienced that advisory, so,
Yes.
it would be good to start seeing those numbers. You're collecting enough
Yeah.
sampling that it would be helpful.
Okay.
And with zip codes, probably, or
Yeah,
geographical
that's-
information.
yeah, that's something that we've been trying to work on.
That would be good if you just
Geographical.
include some numbers with your report maybe next time.
Yes,
and every time. That'd be great.
absolutely.
Good. Thank you very much.
You're welcome.
Just be sensitive, the zip codes will not relate to city, right? So we ran into
Right.
that with COVID, people being upset that their city was this, but their zip code was, so if we're gonna collect it through something, zip code is probably more anonymous than a city doesn't.
Oh, yeah.
And we wouldn't be testing in the city limits anyway, but that's still their mailing address.
I went through peanut gallery here. Some places use townships.
Well, that's a good idea.
Well, I was debating between saying zip code and townships.
What township do you live in?
I don't know.
Yeah, see, no one knows. That's the reason.
I
So.
think they know, but I don't know.
Mo Salem.
Well, well, you live rural and you
I'd like to
live
know where
unincorporated.
they got that name. That's right.
What is yours?
Mo Salem.
Interesting. Never heard of that.
In Salem, Minutemen, trying to think, there's a softball.
Or
team.
a Muslim, but they didn't know how to spell it. I don't know.
That's interesting.
So anyway.
Look that up next time for our meeting, Lenore.
I've asked historians and they don't know.
Interesting.
All right, I think that takes care of that. Thank you very much, Laura.
Yes, and I'm sorry for rushing you, Laura. but
Oh, no, you're
Stacy was on the phone.
Okay, the next action item is the action item that we tabled. And then number 9 on the agenda is unfinished business. The first thing is the ordinance adoption update. You recall a couple meetings ago, we adopted the ordinance and it's gone over to the auditor. And it's in line to go before the Board of Supervisors. There are a couple of other, like the zoning ordinance and another ordinance that's going to go in front of the supervisors before ours, but it's in line. And then the next item is, you recall that we as a board we passed a resolution to ask the Board of Supervisors for money for a strategic planner consultant. That happened in June, I think, maybe June or July. And so far we haven't heard. I guess I could ask Supervisor McDonough if you've heard anything about that.
It's never been on our agenda again, and so it's not considered an active issue. We're not going back to that. I think the conversation is that you're still a board of 5, not a board of 7, and the search for the executive director, staffing still needs some more training. So when is the time to do that? I think is still the critical question.
ASAP. Because
But if you do strategic planning, but 2 voices join you in October, what does that mean?
I know,
Right?
I
But
know.
it's already September, so.
Yes. I mean, we can definitely, I want to make sure that at some point it's going to go before the Board of Supervisors so that our request is at least acted on, yay or nay. So. Okay. And we passed it, the way it was passed here as a motion, it was, we wanted ARPA funds for a strategic planner. So.
At my own peril, I would say my own recollection was that, as Supervisor McDonough says, that no action was taken, but in that meeting, as I'm sitting there, it appeared that there was interest from the board in general, but that they were waiting until you had, as Supervisor McDonough points out, have filled the director position. And I think we may or may not have known that we had 2 vacancies on the board, but those sorts of things. So
it's in line there and it has been talked about and acted on.
Yeah.
Because like I said, we just passed that and
you acted on
right
it.
in the last meeting.
Right, you acted on it. Board of Supervisors received that and
Need no motion to
and
approve
they
it.
didn't do anything with it. But I don't think that there's anything that would prohibit when you have
Yeah.
your new director from revisiting that with the Board of Supervisors.
I understand. I mean, has it actually gone before the Board of Supervisors since we passed it?
Yes,
Here.
it was part of the discussion when you were in the room, Sandra.
Yeah, we passed this after that. Because that was our first proposal and I was there trying to get some money for the Board of Health or the Department of Health. It was a meeting, a Board of Health meeting after those meetings that we had a discussion and we still wanted a strategic planner and the board thought that it should come from the ARPA funds. And then that was about the time Samantha was leaving and I'm just not sure that that passed resolution here got resubmitted to the supervisors. I think you're still holding on some other requests that we made months ago. This is a new one.
So this one, you can direct Ed to do whatever you would like to bring that back up to the board. I will tell you what I feel as a supervisor, and that's the only voice I can give you, but you have 2 new board members who will be joining you likely next week, who will need training from IDPH, right? And then you will have a board of 7 for the first time in many, many months. Some consistency there, just even knowing your names before you start strategic planning is going to be helpful. Otherwise, how do you have discussion? It's the same time China Hip's beginning. So that is that's up to the board. As I observe the board, I don't think you're ready for a strategic planner. That's me. But it could certainly go back up to the board as a I don't know how we get it there.
My impression from just being in the audience there is that the other supervisors are liking the supervisor McDonough.
That's certainly how it was last time I was there, but our board discussed it and wanted it to go in front of the Board of Supervisors again, so that's kind of an update of where our request for a strategic plan consultant is. So I don't know, does the rest of the board, are you okay with waiting?
I'm happy to work with your interim director or your assistant director to help you help the Board of Health maybe put together a sort of a brief memo that outlines some of the action that you had taken and just transmit that to the board. The board would then decide, the Board of Supervisors could look at that and decide if that's the path or some decision point, but it probably won't end up being a resolution. The first step is probably not a resolution, but sort of a formal presentation of that. Board of
Hey,
Health.
we still want it.
Yeah,
So-
please don't forget about
Could
that.
you help her just get a memo?
yeah, I'll- that's
And
fine.
put it on as an action item, but you know, then.
Or
I think part of the issue is that obviously it would be great if we would have China have a new director of the Department of Public Health and we're fully staffed as a board. That would be ideal. But there are issues, I think, that would be helpful to take a look regardless of this situation in the strategy of exerting public health here. That would even be independent of a public health director, where you have to say, okay, are we up to par with what we need to have in place? And for that purpose, I think a consultant is very helpful. I understand the concerns, and this will be very good practical considerations, but we still need to get the question answered. And I think it might also be helpful when you have these data together, when you have them together at the same time, if a new director comes into that role, to have, for example, the China data together, have the board oriented and brought up to speed, and have data from somebody who has a different set of eyes on what they think, what might be the important strategies in the county. Because then you can actually hit the ground running as a public health director with all that information and all the data. Otherwise, you're on waiting mode because you have to wait for all of the above as well. That would be my consideration.
I don't know why I keep injured. One thing that you could do in the interim, again, I'll say you can at your peril of not knowing if that's going to be approved or not further up the chain, you could probably be doing things like exploring. Currently in Iowa, is any consulting firm doing this right now? I mean, there's probably some background information about like who's doing that, and finding out what that was, how that went, what was the cost of that. I don't know. I'm happy to assist Stacy or Laura or any of you board members if you'd like to explore that. There may be some upcoming conferences or things like that, or some people at different contacts at our colleague counties or somebody at IDPH. Probably find that out.
And let me ask it this way. That's from my understanding. Are we sort of restricted to certain kinds of consultants as a Board of Health, or through the county or through the city? I'm just asking. I mean,
I'm not sure what that means, so I'm going to probably say no.
okay.
Well, you all have lived experience with the current Board of Supervisors. So I would ask you to reflect on your willingness to go forward with the current Board of Supervisors to do what it is you're proposing to do. I don't know what it is. I don't get to weigh in. I'm not going to be in your goals and your priorities and everything, but 2 seats are open. You're going to have 2 new personalities join, and you have new staff. So, you know, what's the price tag and what's the benefit gained and why is the time now and all those things. I'm not sure that anything new is being said here. And again, I mean, I want you all to stay. And I don't know how many times you want to be in the newspaper as like, and again, I think the message is clear. the board is with you. It's when are you ready for this?
I think our goal was, well, two things. I think we do want to have a full board, but we also know we steer the ship, not the director. So we wanted to, I think, get that in and not keep delaying. And I think the other thing was because there's elections in November and it could be a whole new board of supervisors, not a whole new board, but 2/3 new board of supervisors
And it's a
potentially.
whole new board.
And so I think that was our goal, to get it done with the board we know and we've worked with, rather than wait. And then, because that'll push us out till January, maybe.
I think that there's probably some legwork that can be done. I think that just as some background, the county, I am not an expert in this, so I think I'm right. Ann probably knows better, but the county has a procurement policy that they just recently updated. So I think if you want to spend 50,000 or more, you got to go up for an RFP. It may be that, you know, the perfect person or group that you identify as this costs $30,000 or something like that. You may be able to skirt like doing an RFP or something like that. But even if you do that, or you decide that even you'd like to do that anyway, you know, we also as staff, I've helped a couple people, other departments do those. You know, we can help you with a tool like that if you wanted to receive proposals from some other groups. We can all help you with that. And again, I'll reiterate what Supervisor McDonough just said was, it seems like the Board of Supervisors is actually with you on that. It's just that timing piece and figuring out that, and how many times do you want to be in the newspaper? So, you know.
I think the other
I-
part of it was, though, we wanted to have at least a little bit of the ARPA funding go to the Board of Health.
Right, and the supervisors, I think, my read on what they said, let me speak for Ann, is that don't tell us what pot of money to use.
what they told us.
You just tell us what your need is.
Yeah.
We'll
But that's
figure
what
out
the-
how we'd like to address that.
But that's what the Board of Health did.
Yeah, that's
So the
right.
Board of Health, I mean, we had a full discussion, and I was actually trying to say, let's not say where we want it to come from, but the board was adamant. They wanted it to come from ARPA funds, and they want it now. We've given a couple of months, but I don't know, do you think we should go back to the supervisors? We're gonna get turned down, obviously, at this point. But
Well,
should we keep trying? I mean, isn't it our duty to keep trying?
Well, I don't know, has it ever been done? I mean, who in the room knows whether we've ever done, have we ever actually done this in Dubuque County's history? I don't think so.
For the Board of Health?
Yes,
Or the department, not that, no, I don't believe so.
right, we don't have that as even a group knowledge, so, you know, I would say maybe setting forth the things you just said, the why now, the no more waiting, the please, the go that way, and this is our plan, and this is who we think it will, you know, this is who we think, how we're gonna get somebody, but there's nothing stopping you as a board to ask the Board of Supervisors to do that. It's when you want to do that. It was left with no motion. There was no motion made.
That was before we passed it the second time.
Right.
Okay, well, then I don't know who didn't carry the water. I apologize if I didn't. But if you're directing Ed to move it on to the Board of
It was
Supervisors
presented
agenda.
to Kevin, and I followed up with Kevin, and Kevin just said, you'll have to ask the Board of Supervisors. So,
You're asking-
Kevin's life's on fire, so, you know.
so,
like-
I mean, I think
He's got
there's
another
some
birthday.
disconnection.
Right,
That's
right,
what I was
right.
following up, because I don't think it's ever been presented again after we passed it.
Right.
So I think what the consensus is that we should do some background work, and that we should do a memo to the Board of Supervisors. Are you okay with that?
Yep.
Okay.
Would you
And
be
then,
fine
once
with
we
Ed
do the
helping?
memo, they read the memo, they act on it, or they don't act on it, then maybe we go back in October, November.
I like the idea of looking in more detail into what consultant scope we need and what kind of consultants is a fit for this purpose, because that can vary quite a bit in experience.
This is exactly what Ed can do for you. And it's
Yeah.
wonderful that you're here tonight.
Yeah,
He'll work with
so,
Laura,
um,
obviously,
Zoom
but
program.
it
Yeah.
will follow up and he'll work with you, Sandra. and-
That would be great.
So the supervisors would say, well, then we have not turned you down, you just haven't done anything. You just haven't had the affirmative that you wanted.
No, we
And
know
that is also, you know, so you haven't actually gotten a no, you just haven't gotten a yes.
Right.
Right,
So doing that background work, I think a yes, my impression is that a yes is coming. If if you kind of work through those steps and you have a staff person here, so, and as long as you're not actually asking for $250,000 to do a study, that would be.
No, it was, Samantha had done the research and it was about 30,000.
Something like that. But
35 or 40, I think.
Right. I didn't, I think she Google searched some things. Samantha and I discussed it, but I think some of the things that I think was that Hendrik verbalized there about like maybe exactly who does that and
Okay.
exactly what that scope looks
Is-
like. That will probably be helpful.
Is the next step having a meeting with you then, Laura, and you and me? or-
It could be. I am at your disposal when you say you'd like to meet. I will meet.
Okay.
We probably have no history to begin.
Sandra, when do you go on vacation?
Monday. I'm leaving Monday for 3 weeks.
Okay, so give time between now and then to do that, or do you want me to pull some stuff together?
That'd be great if you do it.
And as I said, even if that's whenever that is, if you let me know, I am here to help you. So
I
and
do want to
and help
consult you.
Laura and Stacy. I'm here to support them.
Not a mental health consulting, not.
Okay, well, great. That's great.
Yeah.
That's wonderful. At least we have next steps planned. And that's good. That gives us some feeling of we're accomplishing something. So that's good.
I have to go to my next step.
Uh-oh.
Okay.
That's okay. Thank you. Our next agenda item is, thank you for coming, Ed. Our next agenda item is new business. And the only new business I have is that the Iowa Department of Health, our regional director, gave us these books about open meetings, open records handbook. However, these are the property of the health department. So when you're finished with the book, you have to return it. That's, I know.
That's government bureaucracy,
Yeah,
isn't
I
it?
know. Oh,
I'm pretty sure that's available online.
It is,
I would
it is.
presume.
I think
it
it just
So-
comes with that caveat that Sandra must say.
Yeah,
Yeah.
and they even put a little sign on the
Yeah.
back of the books. But I think I'll have the health department hold these books. Do you want yours?
Yeah, I want to look at
Okay.
it. It might be helpful for them.
Because I had sent for one when I first got on the board and I got one for free, so there you go.
Budget.
All right, any other new business? Are there any board communication or reports? Does anybody want to say anything, Hendrik or Amy?
I just want to say that, kind of new business. I had a kind of a little meeting with Caitlin Mueller from Dubuque County Conservation, and she introduced me to forest bathing, which sounds very erotic, but it's not. It's just simply being in the forest and kind of letting it. So I would like to propose that we do some more partnership with Dubuque County Conservation and maybe look into this forest bathing. And there's a word for it. I can't remember if it's German or Scandinavian. I can't remember what the word is either,
Oh.
but look up Google forest bathing. And there was, if
You saying bathing?
bathing, BATHING. Yep, it was just in the last South Dubuque, or 2 magazines ago, magazine too.
Oh,
So
okay.
it's making its way into the public consciousness. I had never heard of it before I talked to Caitlin.
But I think that's a
But-
wonderful idea,
Yes, thank you.
to partner with them because we have a lot of shared interests, I think. And
Mhm.
do you want to kind of, we should maybe keep that on the agenda going forward?
Yep,
so that
I
we
can,
make
I will
progress?
write up a better explanation.
I'll make
for
sure
this.
that we have something on the agenda next month.
I just wanted to make one comment on the boiler alert that we got, because what that I think showed very well is how well we are connected as a public health community. And if we find out there's a gap somewhere, let's move and close that gap quickly. That happened within half a day or so.
Yeah.
Mhm.
yeah.
That was great. And I think that's really something, as you said, that's worth a shout out for the whole team who did this. And that's how it's ideally done, that we pick up the phone or send a text and say, hey, I just thought about this, and it moves forward.
Great.
Yeah, great.
All right, at this time, the next meeting will be on October 19th, 2022 at 4:30 PM. I would anticipate that we'll have special meetings before then for purposes of interviewing candidates for our executive director, but that's our regularly scheduled meeting. At this time, we'll have public comments. Anyone may address the board on matters of which are concerned to that person and which are not agenda items. Please raise your hand if you're on Zoom. And we don't have Zoom tonight, but state your name and home address. Please be aware of the board that the board is limited in their ability to respond to such inquiries And the Iowa Code prohibits the board from deliberating or acting on items not appearing on the agenda. Individual remarks are limited to 3 minutes. Are there any comments? Yay,
I'm a member of the public.
yes.
My name is Diane Pate Fabriger. I live on Middle Road, rural Dubuque County. I'm here to invite you. I had sent an email to both Laura and to Stacy Killian. I'm going to be working with Iowa Immunizes, which is part of Iowa Public Health, on October 1st at the Latinx Festival, and that's going to be down Smokestack from 3 to 8. We're going to, rather than try to just educate people about the importance of immunization, we're going to have them help us to form banners and visuals that are going to be used at the State House when in February, when we go down there to promote immunizations among the legislators. So I'm inviting any Board of Health member that would like to do that. You can contact me or just come down. It's from 3 to 8 in the afternoon, and I think that the music starts at 8 o'clock that night. And I believe they're using the county parking lot also. They're also going to have dancing and any resources from the community that want to just need to, fill out a Google document, and they can do that also.
Oh, thank you, Diane.
But I would like to see, the public health getting some exposure out in the community. And so that if we do need to come to them for things like a pandemic, that they recognize who the health department is.
So like, the staff from the health department could be helpful, or? would
Yes,
be-
they could be at the booth with someone from Iowa Public Health and they're bringing all the supplies. We don't need to purchase anything. All the supplies will come.
Okay, Laura, could you make sure that the staff know about that and
Absolutely.
urge them to participate if they can?
Absolutely.
Yeah, great.
Can I make 2 brief comments?
Okay.
Okay, so Ann McDonough, 2469 Whitetail. In the outreach that I've been doing recently into the county, I do have a concern about the isolation of seniors and the issues that seniors are relating to me. I'm there knocking on doors, so I'm meeting people where they are, and it is concerning. And we have this long wait at the VNA for home health care. I mean, we have lonely seniors who have significant mobility issues. And I don't know who's addressing that. I don't know who the resources are. I don't know, and maybe someone here does, but I don't, and it just is concerning. So that would be one thing I would say. And then related to Food Policy Council, there was at the farm, we had an author that Representative Eisenhart had come on Monday evening to Clark University, talking again about the issues of nutritious food, local food. And then last night I attended the farm to market table dinner out in Dyersville. So that folks there doing the same things. So you hear Project Rooted here in Dubuque and Heritage Trail. But so there is a movement here. I don't know that we've got it all connected, but it is, citizens are really leading us to this issue of farm to market, local foods, looking at, fragility of health related to food. So
That connectedness is one of the issues that I think the Board of Health wants to work with. I know that Dr. Schultz has mentioned it with obesity issues. I mean, there's lots of programs in the county, but they're not connected and no one's coordinating things. And so the health department wants to be that coordinator, I think. So,
is that maybe a question for the health director search too?
yeah, sure.
And the new person that you hire.
Yeah.
Not the health director, a couple more other people.
But yeah,
Right.
I think one of them was that.
it was a
Outreach,
health style, health,
Health specialist.
yeah, something like that.
Lifestyle.
Lifestyle.
Lifestyle, yes.
Yeah, it's chronic disease prevention specialist. That's what
Mhm.
Iowa City calls them. All right, any other comments? Hearing none, is there a motion to adjourn?
Second.
Okay, all those in favor of adjourning, say aye.
Aye.
Aye. Okay, we're adjourned. Thank you all. Very good.
Well done.
Thank you. Thank you for
You're
being
in a
here.
very awkward situation.
Well,
Good to see everyone again.
it's good to see you.
These are,
We know that you're always out there working for it, the health of the county. so.
I have a record number.
Ann kind of got me going on this immunization stuff.
yeah, I had one meeting with you and then it was over.
It's like, okay, she's the one, she's gonna take it over.
Yeah.
Because I would be
So
curious.
I might actually be able to find
On
it.
Monday's agenda, you'll see the candidates.
What if I can't,
Yeah.
So.
give you her number?
So
Yeah, that would be great.
I'll
And I-
put that.
If she's okay with that.
Yeah, I should have something
Yeah.
tomorrow.
Just-
so I know.
just-
I'm sure she'll
But,
be able to.
Did you
Get
see
that
that?
on.
I'll send you a rough
Yeah.
But I do recall seeing it, when she finished it, so
Thank you so
I'm
much.
sure that it's probably still in the computer.
And I hope you guys get to review lots of great candidates.
I do too.
And then this gentleman who's.
Well, have fun out in the, where are you, Michigan or?
We're going to Michigan, it's an old friend, old friend of ours, their daughter's getting married.
What is that?
We have a camper, so we're gonna camp at people's places there by the cities, but then we're gonna go up into the top of Michigan and pick up a
Sometimes you
peninsula. We're gonna end up in Georgia.
Oh.
Yeah.
Yeah, exactly. It's snowing.
It could be, or it could be snowing in the UP too.
I know. So I think it'll be fun.
Yeah.
Should be some good fall colors.
Well, and get some pasties and,
Maybe northern lights.
oh my gosh.
Good to see you again.
Good to see you, Doctor. Take
Yeah,
care.
but anyway. with, Oh,
Call him Doctor. and he says,
debated.
Yeah. Do you
I'm
have
gonna
any
let you
interest
guys
in writing a letter to the editor informing people that Wayne Kinnicker was the reason that the board didn't want to
Sorry about all that.
I'm not sure about that. We'll get it.
I was, the timing on that.
Yes, for sure.
The timing on that
Practice and.
letter could be any time now.
Well,
The IT was.
I-
Yeah, drop it, the link.
I mean, definitely, because that was true.
Well, he's.
But take care,
He's
don't feel
telling
bad
us
about it.
citizens, and he's on the radio saying that we have done too much for COVID. And that if you, I've heard him say at a Eagle Point Park place, that a vote for me is a vote to rapidly expand public health.
Which is such a bad thing, isn't it?
It's just the
Right.
opposite.
Right, but I think that the voice of public health, I doubt that the members of the Board of Health want to do this.